Hello, good evening, everyone. I'm going to give a talk today, and the title for my talk is Prostate Health. This is done in conjunction with Men's Health Awareness Month, which is in June of every year. My name is Dr. Kong. I'm a consultant physician and also a nephrologist. So the outline of my talk would be the following. I'm going to talk about anatomy of the prostate. I'm going to talk about the effects of aging on prostate health problem, the signs and symptoms of prostate health, benefits of prostate screening, and also what are the important information that you can share with your doctor. So who has a prostate? I think a lot of you already know the answer, right? Men do. This is a male health concern. All males, every man has prostate. So what is prostate and where is it located? I'm going to show you some diagrams here so that I can elaborate better for you. So this is anatomy. When you try to look at the man's body from the side, this is what you see. You'll be seeing what we call the bladder, the urinary bladder. Of course, bladder is where you store the urine that is being formed by your kidneys. So kidneys are up above, and then bladder are connected to the kidneys via what we call ureters. And then kidneys will form the urine, and then all the urine will be stored in this bladder. When the bladder is full, the urine will be expelled through our penis via what we call a urethra, which is this part here. But pay attention to this red organ here, which is exactly where the prostate is located. Just imagine this as a tunnel. Before the urine that is being stored in the bladder expelled from the body, it needs to go through a tunnel, which is the prostate. So when the prostate is inflamed, when the prostate has cancer blocking the urine flow, or the prostate is enlarged, this condition would all cause obstruction of the urine flow. And then I'm quite sure a lot of you has gone through this checking before, which is what we call a digital rectal examination. Your doctor would put the lubricated finger with a glove on inside the buttock hole, basically, yeah. And then they'll feel your prostate, and this is why. As I mentioned here, this is our rectum or the anus. Anus is here, rectum is here. This is our layman term, in layman term, we call it the buttock hole. This is the buttock. So when we put our finger on the examination, we can feel the prostate here. We can feel the prostate here. So by feeling it, we can detect whether the prostate is enlarged, whether the prostate is painful or not, or whether there's any lumps or bumps in the prostate that can be cancerous. What about aging and prostate changes? What kind of prostate changes can happen with aging? I'm going to elaborate further in the next few slides. Look at these two diagrams. The first one is normal prostate. As I mentioned, bladder sits on top. And when bladder is full, when the urine is being expelled out from the body, it goes through the urethra. And the first part of the highway needs to go through a tunnel, which is where the prostate is located. So when your prostate is enlarged, or if there is some tumor sitting there obstructing this urethra, then it will be compromising the urine flow. When the urine flow is being compromised, the patient can have various symptoms. And if the obstruction is very severe, not only the urine flow cannot be established, the patient cannot pee at all, but some of the urine can actually backflow and injure the kidneys. But that's not the main topic today. Kidney damage from prostate is entirely another topic. So we are going to focus on the prostate health and prostate problem today. So what are the signs and symptoms of prostate problems? Signs and symptoms of prostate problem could be a few. Number one is increase in frequency, meaning that the patient who has prostate problem, they need to go to the toilet very frequently to pee. One of the reasons is because when they pee, they have incomplete emptying of their bladder because of the obstructing prostate. So, they pee, and then, they still have some residual urine in the bladder, and they need to go pee again and again and again. And then, it will be perceived as increased frequency of urination. The next one would be what we call urgency. It means that when we sense we need to go to the bathroom to urinate, usually we can still wait, right, for a while, and then the urine would not leak out. We would not have an accident by accidentally peeing out, wetting our pants and whatnot. But people with prostate problems, severe prostate problem, they have this urge to urinate. They cannot tahan. When they want to urinate, they really, really want to go and need to go. The third symptom can be what we call dysuria. Dysuria is painful urination, basically. This is usually happening when the prostate is having inflammation. Not so much of a prostate cancer or prostate enlargement, but usually prostate inflammation. And the other symptoms would be hesitancy. Hesitancy means that you need to basically, take quite some time before you can start urinating. And then the fifth symptoms would be what we call dribbling. Dribbling means that the urine stream is not strong, and at the end of the urine stream, the patient need to dribble. So the urine basically dribbles out after the urination. So can you name any prostate health problems? I think I have given you some hints already. I have mentioned all these problems just now. So this problem would be prostatitis, which is inflammation or infection of the prostate. The second one is what we call benign prostatic hyperplasia, which is abbreviated as BPH. It's just medical jargon for prostate enlargement. And the third one is prostate cancer. Prostatitis is inflammation or infection of the prostate. It is commonly caused by infection, basically. The common signs and symptoms would be what we call dysuria, as I mentioned just now. So the patient, when they pee, they have painful urination. And of course, they can have frequency and urgency as well. I mentioned the signs and symptoms for prostatitis already, and the treatment, they are basically being treated with antibiotics because, as I mentioned, inflammation of the prostate usually are being caused by infection. The second issue is BPH. Yeah, as I mentioned just now, BPH is technically a jargon. Yeah, it's jargon for prostate enlargement. The cause is largely unknown, but is related to aging. So this is a very, very common condition that happen in elderly male. Signs and symptoms I mentioned already can be frequency, it can be urgency, it can be hesitancy, it can be dribbling, and sometimes if it is severe, it can even cause some degree of dysuria. But of course, the dysuria or painful urination would not be as prominent or as common as compared to prostatitis. Treatment available, usually the doctor will use some medication to shrink the prostate so that the patient can pee easier. Second treatment would be a surgical treatment. How about prostate cancer? Prostate cancer, as the name implies, is the cancer of the prostate. Again, just like BPH, the cause for prostate cancer is largely unknown. But of course, aging is a major risk factor. So that's why you very, very seldom see prostate cancer happening in younger male. Signs and symptoms, I think I mentioned already, is almost similar to BPH symptom. And also, advanced prostate cancer might give rise to bleeding when the patient is urinating. Treatment available, it would be, hormonal therapy, sometimes radiation therapy, and sometimes resection of the prostate, depending on the stage of the prostate cancer. Early signs and symptoms of all these prostate disorder, prostatitis, BPH, which is prostate enlargement, and also prostate cancer. Unfortunately, a lot of these conditions have no symptoms at all during the early stage. That's why it's very important for you to get medical checkup, which is what we call screening by the doctors, whether you have this condition or not. Just like screening of your kidneys, screening of your liver function, screening whether you have diabetes or hyperpressure is the same thing. Yeah. So screening is a very, very effective way to detect early condition before it gets too late. So it's best to catch early. And how to catch it early? What kind of screening test can be done? Number one is, of course, a blood test, which is called PSA. PSA stands for prostate specific antigen. This test is important, and this test is useful. Although, when the PSA is elevated, if the PSA is elevated, it can be due to prostatitis or BPH or prostate cancer. So you need to basically talk to your doctor regarding, what actually causes the PSA to be rising. Another one is digital rectal examination. So as I mentioned, when we put our lubricated and gloved finger inside the rectum, we can feel for the prostate whether or not there's tender, whether or not it's enlarged, whether or not there are lumps and bumps that can indicate cancer of the prostate. Of course, these are just for screening purposes. If these are normal, we continue screening. But if these are abnormal, then we need further investigation to delineate or to distinguish what kind of condition that causes the abnormality of these two tests. When should we begin screening? We recommend people with high risk to begin screening at the age of 40. And then low risk or moderate or usual risk, we begin at the age of 50. So what does it mean by high risk? One of the main high risk is family history. If a person has a very strong family history of BPH or even prostate cancer, then we should start the screening early. I cannot emphasize enough on the doctor-patient communication. A lot of mismanagement of the patient is not because of the patient's problem, it's not because of the doctor's problem per se, but it's basically a miscommunication between the two parties. So when you go see the doctors, if you have any worries, if you really have symptoms that I just mentioned, if you are concerned whether you have this condition or not and you want screening, talk to your doctor frankly. Don't hide any details. And then discuss with your doctor whether you should be starting the screening, whether the screening for you should be started at the age of 40 or 50. I think that was my last slide, and thank you for your attention.